still there?
I'm here.
Okay, wonderful. Erin, I can't see who's on the call, but are we all,
yes, we're good to go.
Is there any, we're good to go, okay. All right, Dr. Contreras, we're still good on time. I had booked you till 1:40, and I don't think we need a lot more. I just wanted to give, first of all, you did a wonderful job. Thank you so much. You're so easy to understand, well-spoken, and I think it's going to be a great piece, so I appreciate your time. And as the reporter said, Erin is part of our team, and so she'll get the article to me, and then I'll get it to you to make sure that you're okay with it. I also just wanted to give a chance for our writer, John, who's on the line, to see if he had any additional questions or clarifications that he had for you for the story that we're writing on for the Baptist Health blog. So, John, do you have any questions for Dr. Contreras?
I think just a couple. Thank you, doctor, for being available. You did a great job on explaining brachytherapy. And I know I spoke with earlier, late last year, I spoke with Dr. McDermott, the way they did brachytherapy on a brain tumor patient, one of the first at the at Miami Neuroscience Institute, and he spoke very highly of the work that MCI and doctors like yourself are doing with brachytherapy. But you mentioned, and my colleague Peter is going to speak to Miss Mills, the patient that was mentioned earlier.
Okay.
And I know from notes that I got that she was diagnosed with stage 4 cervical cancer. And you mentioned briefly just a few minutes ago that her case was, I believe you said, atypical?
Yeah, it's atypical because patients that normally get diagnosed with stage 4 cancer, so her case, so often when cancer has spread outside of where it started or in the area that we would treat, those patients just get chemotherapy, which was Miss Mills's case initially. She had a couple of lymph nodes far away from her cervix primary. She had a great response to chemotherapy, and after she finished chemo, the only area that still had disease was really in her cervix. So we treated her more aggressively than others might have, but she didn't have disease anywhere else. So we gave her local treatment, and so far she's done amazingly well a couple of months later. So it's atypical in the sense that it was a stage 4B diagnosis, and she still received the treatment she did. But otherwise, her brachytherapy and the tumor-directed therapy that she got from a radiation perspective would be the same than another patient that presented in a more locally advanced cervical cancer manner would receive. Okay. Does that make sense?
I think so. And I know a lot depends on the specific diagnosis. In this case, I mean, fairly advanced of stage 4.
Yeah, so I wouldn't focus so much on that for her part. Okay. I would focus for her more on like the actual radiation, the chemo radiation that she received for her cervix after she completed all of the chemotherapy up front.
Okay. And how long was her total time, or in terms of under chemo treatment and then the brachytherapy? Do you remember the amount of time involved in her treatments?
Yeah, so I don't remember off the top of my head the month that she was on chemotherapy prior to seeing us, but once all she had was in the cervix, so once she presented with only cancer in the cervix, her care, her external beam radiation lasted 5 weeks, and then she had about 2.5 additional weeks of brachytherapy. So her total treatment time from a radiation perspective was roughly 7.5 weeks.
And her recovery, how did it go as far as you remember or recall?
Very good question. So I think she had some fatigue and some issues at the end, but I would say she was feeling well by the time I saw her at her 6-week follow-up. So her energy was back to normal. Her bowel and bladder function was back to normal. So I would say a couple of weeks. For most patients, they usually feel they start to recover about the second week after radiation treatment is completed.
Is there anything else about her case specific that stands out for you? I mean, she's in her 50s, mom of 5. I don't know. She's an African American. I don't know if she had a family history, but is there anything else that stands out?
I think Ms. Mills represent kind of the patient that we see with cervical cancer. So most of our patients with cervical cancer are patients that don't necessarily have access to routine screening pap smears, so don't have like regular insurance access, usually have a lot of other social factors that can be affecting their ability to get care. So from that perspective, Miss Mills is really representative of what we see. You know, it's a, you know, she's in her 50s, and that's not abnormal. You can see younger women, but often they're women like her who, you know, may not necessarily have the best access to care from the beginning, or have the same resources that a lot of other women have. And unfortunately, those are the patients that are most commonly affected by cervical cancer. So from that perspective, her case is not uncommon.
Okay, great points. I think that's it, unless there's anything else you want to say about her case, or I know my colleague will interview, Peter will interview her later today, I believe. So I guess he may want to get back to you or email through Papsy another question or two for you after he speaks with the patient. So, but I appreciate your time and your expertise. This is very great information.
If I ask a quick question, this is Erin. So there is an article on Cancer Therapy Advisor about racial disparities in the usage of brachytherapy, and you were just kind of touching upon that. In fact, they said that that compared with non-Black women, that the usage of brachytherapy was lower. So they usually had access, and basically what the study concluded was that the survival too. It said conclude that improving access to brachytherapy for Black women with cervical cancer may improve overall survival. So I know that we didn't touch on it in the interview, but is that something that maybe you can send some points to the reporter on, if you have anything to comment there, or how they can improve access, or, you know, how to improve options?
Yeah, no, I mean, you're completely right. So, you know, it's a lot of the times it's access to resources. And unfortunately, Black and Hispanic women or minorities, women of color, are usually the ones that are affected the most. And like you mentioned, I briefly touched on it with her more so in the sense that all patients should get brachytherapy. But you're right. It's the patients that can't travel, you know, 2 hours to go to a center that offers brachytherapy. And oftentimes it'll be the patient population that you described. So I haven't specifically seen that article you're referring to. If you could send it my way, I'd love to review it.
Sure. Yeah.
But most of the articles that we see deal more with socioeconomic status, which again, I mean, it's a surrogate, right? It's not that different. But yes, no, you're completely right. Access to care, and often it's these patients that are forgotten or don't have the same resources. And without brachytherapy, they're just not going to have the same rates of cure or you know, not live as long than someone that would have access to this type of treatment.
Okay, so we'll just underscore the importance of knowing your options and what's available for as you said, surgery may not be the best option.
Correct.
It's understanding what else is available. So
Perfect.
great, thank you. And I'll send you, it's an outdated article. It's a year old, so I know a lot can change.
Oh no, a year isn't that old. Yeah, I'm curious to read it. Send Papsy that, and you can include it with the reporter and send a couple extra notes in addition to the ones I'll put together for her.
Great.
Wonderful. Well, thank you so much. I think we actually finished 3 minutes early.
Wow.
And knocked out 2 articles in one day, which is amazing. So Dr. Contreras, just so you know, we canceled the meeting for tomorrow because we just were able to, you know, do it efficiently today. So thank you so much for your time. And yes, I will be following up with you via email on any on the links to the article and any other notes that we may get from the reporter.
Perfect. Okay. Thank you.
Thank you.
Bye, everyone.
Thank you. Have
Take
a
care.
wonderful day.
Take care.
Bye.